Hello friends, I welcome you all to this wonderful series where we are going to discuss multiple useful mnemonics in dermatology which are belonging to high-yield topics that have been asked in the previous 5 years. So let us begin. So we have got our first mnemonic here, so it's an analogy. So our human epidermis, it's like a wall where we have got stratum corneum, which is like a roof, and rest of the epidermis is forming the wall. Now a wall has bricks, a wall needs a painter, a wall later on we apply the electric switch over the wall. Similarly, our epidermis has bricks which are nothing but your keratinocytes. So we have this histology of epidermis. So what are the various layers in normal skin? Epidermis, it is stratum corneum, then we have stratum granulosum, then the thickest layer stratum spinosum, and basal, which is at the last. Single layer of keratinocytes along with some other cells form stratum basal. Now our human epidermal wall has multiple bricks which are your keratinocytes which are attached to each other with the help of cement, and we have also a painter that paints your bricks. So the painter is nothing but your melanocytes. So melanocytes are the painter. Third thing is the switch connection. So the electrical switch is attached at the base. So the location is important. That's why this mnemonic is very important. In exams, they ask you the locations of various cells in the epidermis. So the bricks are keratinocytes. So all over the epidermis, they are in plenty. Also, we have got painters who are standing on the base. So painters which are melanocytes are located in stratum basal, right? Also, number 3 is your Merkel cell which are located somewhere around here in the stratum basal. So Merkel cells are your mechanoreceptor for tactile sensation, and they are like electric switch connected to wire or cables which are like your nerve fibers. Are you getting the analogy, the similarity, right? So we have done 3. Number 4 is your lamps. So we have lamps hanging on the wall or light bulbs. These are similar to your Langerhans cell. So Langerhans cell which play important role in your defense system. So they are like light bulbs hanging on the wall. So light bulbs hanging on the wall, it's very important because their location is in stratum spinosum. So Langerhans cells are located in stratum spinosum and they are blinking. As soon as they see any foreign substance, they blink. So they are lamps. So they play a role in our immunity, in our defense system, right? So the keratinocytes are the bricks, and that's why they form 90% of all epidermal cells, which is a MCQ. Second thing is the location of melanocyte, which is stratum basal. These are the painters, and one painter in our skin paints 36 bricks. That is, one painter will paint 36 keratinocytes. So one melanocyte is for 36 keratinocytes. So this ratio of 1 is to 36 is known as epidermal melanin unit. So this comprises your epidermal melanin unit. Clear? Also Merkel cells, which are touch receptors, are they slow adapting or fast adapting? They are slow adapting. Basics physiology. And they are located in stratum basal. So they are like switch, as I have told you. So it's easier to remember now, isn't it? Langerhans cell, they are hanging in somewhere around stratum spinosum. So this is very important. So now I have a question for you. Has been asked recently in AIIMS. So it's a very high-yield topic. So they have asked you which of the following cell is not located in the layer marked below. So what is the layer marked? It is stratum basal. So the layer marked here is stratum basal, and we know in stratum basal we have keratinocytes, yes or no? Yes, they are the bricks. They are present everywhere. Melanocytes are the painters on the base, standing on the base, right? And we have Merkel cells which are switch on the base. So all these 3 cells, they will be present in stratum basal except Langerhans cells which will be in stratum spinosum. So this is the answer. Langerhans cells are not present in stratum basal. So isn't it simple now? So mnemonics are very useful in cracking any PG entrance. So make sure you write down your mnemonics in a separate mnemonic book. I used to follow the same. So I used to make a short book of mnemonics and I used to revise it multiple times. Mnemonics also need revision. You cannot just blindly make the mnemonic and forget about it. So wherever you write it down in your notes, whenever you make a new mnemonic, please make a separate mnemonic book. Add that mnemonic in the mnemonic book. It will be very helpful, right? So another question we have here, important question. So it is asking about stratum malpighian. So we have talked about 4 layers of epidermis. In that, stratum malpighian is which one? The question is asking the same. So stratum malpighian is a combination of 2 layers. So out of this, what is the answer? So at the time of exam, it becomes confusing. That's why mnemonics help. So the mnemonic is stratum malpighian is a layer which is combination of stratum basal and stratum spinosum. So stratum basal and stratum spinosum together constitute your malpighian layer. Now how to remember this? Sweet mnemonic. So pigeon is a sweet bird. Pigeon is nothing but your malpighian, and sweet is spinosum, and bird is basal. So now it becomes very crystal clear. So please solve the MCQ. The answer is malpighian is pigeon, sweet bird. So sweet bird, spinosum and basal. So your answer is A. Within a fraction of a second you can answer such questions if you are well versed with mnemonics, right? Alright. All are primary skin lesions except. So this is a question of basic dermatology. It's very simple, but at a time of exam when you have 19 subjects, lot of topics, different topics, and you know to jump from one topic of one subject to another topic of another subject, it might become confusing and you can do silly mistake. So here again the mnemonics will be helpful. So what is the answer here? So primary skin lesions are the skin lesions which develop first. So they are the initial lesions of the disease. Examples are multiple: macule, papule, plaque, nodule, vesicle, bulla. So vesicle, bulla are fluid filled lesions, right? Fluid filled lesions on the top of the skin. And we have pustule, purpura, ecchymosis and wheal and petechiae. List is long. Similarly, we have secondary skin lesions which are modified by scratching or treatment or the disease evolution. When the disease evolves, it can develop secondary skin lesions like scaling, crusting, erosion, and we have got multiple: laconification, ulcer, fissure, atrophy and excoriation. Now we have got a wonderful mnemonic here. So mnemonic related to a primary school. So in primary school we used to say A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. So the mnemonic is same. In primary school we say M, N, O, P. So primary is for primary skin lesions. So the mnemonic itself has the topic for which the mnemonic was made. So it becomes simple at a time of exam. Otherwise, if you just randomly make A, B, C, D, you will not be able to recall for which topic was the mnemonic, right? So I have made a mnemonic in such a way that the topic itself is there. So in primary, it is for primary, it is not for secondary, na? So primary school we say MNOP. So V, W-E-M-N-O-P. Anything starting with W. So wheel. E, ecchymosis. M-N-O-P. So M, macule and nodule. P is pustule, papule, plaque, purpura, petechiae. Anything starting with P is primary skin lesion. Also we have got here O. What is the meaning of O here? So I have told you vesicle and bulla, they are fluid filled lesions on the skin and they look like O. So the shape of vesicle or bulla, you can say it is like O, isn't it? So M and OP, vesicle and bulla including, these are primary skin lesions, right? So only thing is that there is exception to the mnemonic. So we have included ecchymosis as primary, but erosion and excoriation, these also start with E, but these are secondary skin lesion, erosion and excoriation. So you should also know the exceptions to your mnemonic sometimes, right? Okay, let us solve. So all the following are primary skin lesions except. So in primary school we say MNOP. So N, MNOP is N is here. O is the shape of vesicle or bulla, M and O. P we have purpura. What about laconification? So here the answer is laconification. It becomes very simple. Otherwise you have to keep on recalling what was the answer, what did I read. So what is laconification? Just for your revision, I am showing you here. Laconification is a chronic form of dermatitis where you see the patient is constantly scratching a lesion, and because of constant scratching, he or she develops increased pigmentation. You can see the skin is darker as compared to normal. The thickness of the skin also has increased. Along with that, the skin markings are quite prominent, isn't it? The skin markings are prominent as compared to normal. So this triad comprises your laconification. It's a form of chronic eczema or chronic dermatitis where you see increased pigmentation, increased skin marking and increased thickness. Clear till now? Right. So another question, which of the following is not a papillose squamous disorder? Another important topic. So what is the meaning of papillose squamous? So any lesion that is having papules or plaques with scaling. So papules or plaques, squamous means scaling, will classify it as papillose squamous disorder. Classic example is psoriasis, silvery scales with erythematous plaque, right? So it is a case of psoriasis, which is a papillose squamous disorder. So we have this big list again, how to remember which is papillose squamous, which is not papillose squamous. So again, I have got a wonderful mnemonic. My pet snake likes soft drink Pepsi. So there we had a pigeon, here we have snake. So my pet snake, my is Mycosis fungoides or Mycosis fungoides. Some people pronounce it a different way. So what is MF or Mycosis fungoides? It is a form of cutaneous T-cell lymphoma. P for multiple, psoriasis, PRP, that is pityriasis rubra pilaris. So wherever you see pityriasis, what is the meaning of pityriasis in dermatology? The name itself can provide you a clue. Pityriasis means scaling. So scaling we will connect to papillose squamous. Pityriasis lichenoides, again pityriasis rosea. So pityriasis, wherever you get scaling, you can think of papillose squamous disorder. We have PET, P-E-T, E for eczema, T for tinea, fungal infection, dermatophytic infection. Snake is secondary syphilis. So remember, it is secondary syphilis, not primary, not congenital syphilis. It's secondary syphilis, 2S. And we have likes, Li is for lichen planus and lichen nitidus. We also have soft drink. What is the meaning of soft drink? Soft drink is your seborrheic dermatitis. And we have again the topic name attached here. Pepsi is papillose squamous. So this mnemonic is for papillose squamous disorder. List of papillose squamous disorder. Right. So now let us apply the mnemonic here. My pet snake. P again. Pityriasis means scaling. Pityriasis lichenoides chronica. Again we have. So our answer here is congenital syphilis, which presents with vesicles and bullous lesion, not papillose squamous lesions. Right? Clear? Okay, so this is pretty simple. So this has been written in multiple books through ages. 5 P's of lichen planus. Please tell me right now. 5 P's of lichen planus. Purple, plain top, pruritic, polygonal, papule. Right? So purplish, plain top, flat surface, pruritic, itchy, polygonal in shape, and papules. Simple. So 5 P's of lichen planus. So they can give you a case scenario and ask you the diagnosis. So it is lichen planus. Pretty simple. Now, psoriasis. There are certain areas of psoriasis which are important. So causes of drug-induced psoriasis. Sometimes psoriasis can be because of some drugs. The mnemonic is Balto. So here we have dog. We had pigeon, snake and dog. Isn't it pretty? So Balto. Beta blocker. A is anti-malarial. L is for lithium. T is for terbinafine. Terbinafine is an antifungal drug. And most important is oral steroid abrupt withdrawal. So as soon as you withdraw steroids on a patient who is having psoriasis, the psoriasis can aggravate and lead to pustular psoriasis. This is another MCQ. Pustular psoriasis often is precipitated when a patient is put on oral steroids for psoriasis and suddenly the patient stops taking steroid. Then it will lead to exacerbation and a new type of psoriasis, which is pustular psoriasis. Right? Alright, so Balto, drug-induced psoriasis. Right. Also another important thing is manifestations in the nail related to psoriasis. So mnemonic itself is hidden in psoriasis. PSO of psoriasis. So P for pitting. So nail pitting. Which type of pitting we see in psoriasis? It is coarse nail pits. Fine nail pitting we see in alopecia areata. So it is coarse, not fine. S is for subungual hyperkeratosis. So beneath the nail plate, we get a debris, hyperkeratoid debris, that is subungual hyperkeratosis. We also have onycholysis, distal onycholysis. What is the meaning of onycholysis? Separation of nail plate from nail bed. And oil drop sign. The another name for oil drop sign is salmon patch. So signs are important, eponyms are important, right? So oil drop, O for oil drop sign, which is nothing but yellow to reddish discoloration just proximal to your onycholysis in the nail bed. So this is your oil drop sign or salmon patch. Clear? So another important thing is histology. So histology of psoriasis, histology of lichen planus is very important. You should know that. So what is being shown here? Let us zoom it. So psoriasis, the first and foremost thing you note is that the thickness of stratum spinosum has increased, which we label as acanthosis, regular acanthosis. So in psoriasis, we see the acanthosis is regular, equal. So when you compare one rete ridge to another rete ridge to another rete ridge, they will be in same line because of regular acanthosis, right? So second thing is in stratum corneum, parakeratosis, that is retention of nuclei in stratum corneum. Third thing is your dilated tortuous capillaries in the papillary dermis, and above that you can see the epidermis is thinned out. The epidermis is thinned out, which we label as suprapapillary thinning. Suprapapillary thinning. And one more important finding, the thickness of granular layer which is present below stratum corneum is reduced. So we call it as hypogranulosis. Now putting all these things down into our mnemonic, again the mnemonic is related to psoriasis, PSOR. So P for parakeratosis, which is nothing but your retention of nuclei in stratum corneum. S, suprapapillary thinning. So this is the suprapapillary thinning, it is thinned out, right? We have O is very important. O is micro Munro abscesses, Kojoc pustule. So these are micro abscesses. We sometimes see collections of neutrophils, so that we label as micro abscesses. Two micro abscesses, eponyms again, Munro and Kojoc, O. So in psoriasis we have O, that is related to Munro and Kojoc pustules, you can remember that. And we have got R, that is reduced granular layer thickness, that is hypogranulosis. This is very important. The option will come as hypergranulosis, but it is not hyper, it is hypo. That's why R, reduced, right? And another R is for regular acanthosis, that is increased stratum spinosum thickness. Clear? Pretty simple, right? This is very interesting mnemonic. So TNF alpha inhibitors, pharmacology. So TNF alpha has various applications, including dermatology, we use it, in psoriasis we use it. So what are the various TNF alpha inhibitors? Examples they ask. So 5 drugs: infliximab, etanercept, adalimumab, certolizumab and golimumab. So we have got a Hindi mnemonic here. A boy is thinking about a girl and he is telling, inki itni adaye certainly goli khilayegi. Goli is like, so inki itni adaye certainly goli khilayegi. So it's a romantic mnemonic. So inki is infliximab. So it is not just ABCDEFG. So we have some initials. Infliximab. Itni is etanercept. Adaye is adalimumab. And we have certainly certolizumab, golimumab. Right? Now it's pretty simple. So making mnemonics makes the things way easier. So you will be very comfortable in such difficult to remember topics, right? Another monoclonal antibody, rituximab. So rituximab is a monoclonal antibody. Nowadays they are being used as first line of treatment in pemphigus also, apart from other autoimmune conditions. But what you should know is that it is a CD20 monoclonal antibody. Now how to remember CD20? Rituximab starts with R. So R has number 2. So it's 2 plus we can write it as 0 inside. So CD20 is rituximab. Easy? Right. Okay, so here is a difficult question. So when this was asked, like many of the students were not able to answer. So which is a true association they have asked? Lichen planus and malignant melanoma, melasma and malignant melanoma, psoriasis and metabolic syndrome, vitiligo and metabolic syndrome. So it's a simple answer here. The mnemonic is APLA. It is not antiphospholipid antibody syndrome. The mnemonic is APLA. So cutaneous disorders, so disorders in dermatology that are associated with metabolic syndrome are by the mnemonic APLA. A for acanthosis nigricans, P for psoriasis, L for lichen planus, and A for androgenic alopecia. So these 4 disorders you should know. Mnemonic is APLA, right? So now you can tell me the answer. Answer is psoriasis and metabolic syndrome, right? Easy. So what are we able to see here? This is a case of lichen planus, some purplish hue, you can see that. So there are some lesions. The patient has scratched here and the patient developed new lesions at the site of trauma, which is nothing but your Kibner's phenomena. Now Kibner's phenomena is shown by lichen planus, that is true, but many other conditions show Kibner's phenomena, that is also a MCQ. So this is the list and the mnemonic. Little plants can make wind very decent. This is true, right? Little plants can make wind very decent. So little is lichen planus and lichen nitidus. Plants is psoriasis. We have got can for Kaposis sarcoma. Make is molluscum contagioso, infection. And what? So both are infectious condition, viral, cutaneous disorders. So make wind very decent is vitiligo and Darius disease, as well as discoid lupus erythematosus, chronic form of cutaneous lupus. So out of this, 2 are infections, and when we see Kibner's because of infection, it is not a true Kibner's, it is because of the spread of the virus. So similarly here, so you can see this is a Kibner's, but this is not a true Kibner, this is pseudo Kibner because it is case of molluscum. So because of spread of what from one place to another, auto inoculation, we get Kibnerization, which is a false pseudo Kibnerization. So wart and molluscum, they show pseudo Kibner's phenomena, right? So very important, has been asked 3 to 4 times. Histology of lichen planus, which of the following findings will not be seen? So Max Joseph space, basal cell degeneration, Seward bodies, and Munro micro abscess. So what is the answer? So let us discuss with the help of a mnemonic. So this is how it looks, lichen planus histology. What you can see here, first of all, you can see there is a band which is not normally present in the dermis, just below the epidermis. So this is a band-like infiltrate of lymphocytes which damages your basal layer of keratinocytes. Along with that, are you able to see this? So the granular layer thickness, is it same or reduced or increased? It is increased. In psoriasis, the granular layer was decreased. Here it is increased, hypergranulosis. And also we have got here some bodies. Here you can see the pink bodies. These are apoptotic keratinocytes. So these keratinocytes are known as Seward bodies. Along with that, one more important finding. So let me show it to you here. So as you can see here, the shape of rete is like sawtooth shaped, sawtooth rete ridges. Also second thing is the shape of hypergranulosis. It is like a wedge. So wedge shaped hypergranulosis. So these are all the findings of lichen planus. So wonderful mnemonic. So we have dog and cat this time. So Max saw a big cat and got hyper. So Max is your Max Joseph space. Saw is sawtooth rete. Then we have big is for basal cell damage. That is very important finding in lichen planus. The lymphocytes attack the keratinocytes in the basal layer, that leads to basal cell damage. Cat is Seward bodies or colloid bodies, eponym. Very important. Hyper why? Because hypergranulosis, not hypo. Hypo is seen in psoriasis. So this is how you should make mnemonics. Simple to remember and you can correlate. So let us solve with the help of mnemonic. Max saw a big cat. Max saw a big cat. B. Cat is Seward and got hyper. So it is nowhere mentioned in the mnemonic Munro macro. So answer is Munro macro abscesses, which is seen where? It is seen in psoriasis, right? So another MCQ, Portrier's macro abscesses. So Munro macro abscesses was in psoriasis. Portrier's macro abscesses is in mycosis fungoides, which is a cutaneous T-cell lymphoma. Now compare the two pictures. Here we have got very important finding. So collection of neutrophils in the stratum corneum, and here we have got collections of lymphocytes in the epidermis, abnormal larger lymphocytes. So we have got collections of lymphocytes in the epidermis, which we label as epidermotropism. We have collection of neutrophils here in the epidermis, specifically in the stratum corneum and to some extent in the stratum spinosum. So we have got, this is a case of psoriasis where we see Munro micro abscesses. So these are Munro macro abscesses seen in psoriasis. We have got Portrier's abscesses seen in mycosis fungoides. So collections of lymphocytes in epidermis, intraepidermal. Now in exam we get confused whether Portrier was for psoriasis or not. So the easy way to remember is crossway. So M is for P. So M is for P and P is for M. It is not M for M. Munro is not for mycosis. Portrier's is not for psoriasis. It's the reverse way. M for P, P for M. Simple now. So this was all, friends, for our part 1. We'll be coming up with more interesting videos and wonderful mnemonics in further sessions. Till then, make sure you make down the notes and revise it multiple times before attempting your exam. That is very important. Okay friends, take care and goodbye.